we are, Renee, coming from Alabama, Tuscaloosa. What conference is it that we're attending this week?
We are at the VitAL Alabama National Association for Rural Mental Health, NARMH conference.
That was actually two conferences. It's,
they kind of
it's the
blended.
Alabama Rural Health Conference and NARMH together in one conference this year. You know, we've been to the NARMH, National Association for Rural Mental Health conferences in the past and really gotten a lot out of them, really enjoyed going to those conferences. I think we started going 2 years ago. I think we were out Boulder, Colorado. And then we were in Pittsburgh last year, Pittsburgh Steelers game.
Yes.
Steelers. And this year we find ourselves on campus here at the University of Alabama.
It's crazy.
I'm
glad we're not going to be here for the first football game. It sounds like it's insane in Tuscaloosa on game day.
Next week.
Next Saturday.
Well, next Saturday.
A few weeks.
Just a few days from now. So we are going to get out of town because we're told they start parking cars to get into the tailgates starting Wednesday. What is this? So tomorrow,
yes,
they'll be starting to pack into because there's not a lot of parking. This is a very interesting
place. So
campus.
For those that don't know, because I looked it up, Tuscaloosa itself is about 38,000 people, and the football stadium holds over 100,000, almost 101,000 people, and there's not parking, I'm telling you, for all those people. And so they come from everywhere, and then we just learned at breakfast all about the shuttling in and all the things.
Yeah.
It's a lot going on here in Tuscaloosa. It's amazing to be here to see it because it's not at all what I thought it was in my head, so I'm glad to be here. So today we're going to talk about what did we learn at the VitAL Alabama conference and the NARMH conference, their combined conference. We're going to talk about some of the different things that we learned, and we're going to talk about, we actually presented also, we'll chat about that in a little bit, and then just kind of give you what's up and coming for NARMH in the future. We're really excited about where they're headed next. We'll talk about that too. So did we talk about the farm? And you have no internet?
No. Well, no, the internet's fixed.
Oh.
Well, kind of. My home went out. And so did my air conditioner. And it's during a time period, it was late summer. It's really hot back in Iowa.
There was a heat advisory.
There was a heat advisory, and I didn't have air conditioning. So I could see for a while on the app when it got up to like 81 degrees, and Jennifer wasn't happy. But she got it fixed. All is good. Our local air conditioning guy showed up and took care of it all. But then our internet went out. And so then she couldn't control the thermostat because, of course, a smart home, it's not so smart when you don't have internet. Yeah, I know.
Without power.
No, it's not so helpful. So all of that was going on. So that's not really a farm related thing. But, you know, on the home front, when you're traveling, you've got to kind of juggle everything.
Yeah.
Remotely.
My wife's not happy. No.
Nobody's happy, but she's all good now. So all good.
Fix that.
I know.
Previous episode, we did a deep dive on the keynote of this conference, which was Johnny Manziel. And if you didn't hear that, you need to go back because that was amazing. I'm still thinking about it. So good. But after that, we started rolling into lots of other great topics. And we met somebody, we've heard of her, but had never met her. Ashley Norwood Strickland is a doctor of psychology. She's actually a psychiatrist.
Yep.
And is an adjunct professor at the University of Iowa, who we didn't know. And so we came all the way to Alabama.
Oh, I got to meet with her for a little bit. And she's done a lot of her, you know, she's 100 hours away from being able to prescribe in Iowa, actually. But she's been up in Sioux City. And so she's done a lot of her work in Sioux City. And so she's had to take that drive from Iowa City across Highway 20, the whole state, to Sioux City. And so she talked about that a bit in her keynote address about driving across Iowa. And I was offended for a minute because we're here in Alabama. And she's like, you all don't know rural until you've been up north where I'm from. And I'm like, wait a minute. That's exactly where we're from. And so we often say that when we go to North Dakota or South Dakota, you don't know rural until you've been. And so we just kind of see across the country how that definition of rural, and that's what she talked about.
Yeah.
A good part of her presentation was what is rural? And, you know, there's 62 different definitions depending on what government entity you're with, you know, and at the end of the day, does it really matter what the definition? It does for funding and stuff, but it really matters about system design, right? And how are we going to take away those barriers that we know occur and really address the equitability across our rural communities, right? And so, you know, again and again, we're talking more and more about equitable care and how do we bridge the gaps. And so it really doesn't matter how rural you are. If you're rural and you don't have equitable access, then it's an issue and it needs to be addressed. And so sometimes we got to get out of the weeds on the definitions and really just dig into what can we systemically do to address equity across rural communities.
Right. And some of the big issues are the same that we talk about in other conferences. It's going to be the use of telemedicine, telehealth. It's also going to be the use of mobile crisis. We'll talk about that a little bit more in the future. They're really excited about the rollout of 988. That's today's conversation. It's all about 988. We'll get to that in a minute. And so it really is thinking about like what are all of the different things nationally that and how you can bring that locally to a rural community, because not every rural community can do all the things. It's really important.
Absolutely. And I think as we think about, it's hard to mute when you're in the same room. It doesn't matter. So that's real life, right?
Oh, the pollen count's killing me down here.
Yeah.
Dying.
Yeah. All right.
I was sneezing most of the evening. So, sorry about that. So we're talking about, then we go into breakout sessions. So you have the 2 plenary sessions, which was the PhD that we just talked about, Ashley, and then Johnny Manziel was before that. And then after that, we go into some breakout sessions. And so we did 2 different ones. I did one related to mental health and first responders and enhancing the relationships. And what I thought was interesting about that, I thought that was going to be more about mobile, because I was reading into mental health and first responders. So I thought we were talking mobile, but we weren't. We were actually talking about mental health first aid and doing that for law enforcement. And I know you teach that all the time. So you're well aware that there's a law enforcement version of mental health first aid. But one of the VitAL Alabama staff teaches it and does a lot of work with it. But she went into great detail just about how in rural communities, the person that's on the front line, the front responder, could be the person that rolls up on the accident and knows the person that has been killed in a car accident, that comes upon the domestic violence situation and has to separate people. And then those people could still be people they sit next to at church on Sunday or have to go to work with on Monday, and how all of that plays in that rural area. And it was a very interesting conversation, just reminding everybody how real that is. And then oftentimes folks on the front lines just don't like to talk about it.
Right.
So there's lots of PTSD and they don't talk about it. And so the whole concept of that particular conversation was to encourage the men to speak about it and that they could get help and get the healing that they need if they start talking about it, and trying to figure out how to reach them. So one of the things I really appreciated is they have law enforcement peers specifically to do peer support with law enforcement. And they're showing great progress in having that, because retired law enforcement understand law enforcement, because that's part of their situation is nobody might understand what they do. And I feel like that in parole, right? There's one parole board in the state of Iowa, and there's 5 of us on the current board. There's some previous members that were there that wouldn't understand, been there, done that, can talk about it, but it's a very weird job. And so you can't just have like the most people that if you try to talk about it, people will be empathetic, but they just don't get it because it's not their job. Law enforcement's the same way, first responders. And so it was really, really good. And I really appreciated that breakout.
Yeah. So, really thinking about those trauma-informed approaches. I think that as we look at the different specialties, as we kind of go through the list, you're going to kind of see that a lot of what we're talking about is how do we bring trauma-informed approaches to all these different specific subcategories? How do we reach these subpopulations who are most at risk? And at the same time, I was at a conversation in the room next door where AgriSafe presented. And, I think a lot of you all are familiar with AgriSafe. We'll link to AgriSafe. But, they're all about health of rural communities, and they do a lot of safety stuff, but they're also a lot in the behavioral health sector as well. So really looking at training, education, how do we support rural communities and how do we support farmers and farm workers as well? And so many of the same conversations, right, of what training products can be utilized. The unique thing about AgriSafe is they really love to partner with states or communities in order to help to leverage things nationwide. One of the key takeaways, though, for AgriSafe is they're rolling out a hotline that's rural informed, right? And so part of what they do is bring trainings to other professionals so they understand the ag community, right? Because you can't say to a farmer or a dairy, especially a dairy producer or a livestock producer, you know what, you need to take 4 or 5 days off and take a break, because that's not a thing, right? So if you're a physician or a therapist and you lose all credibility the moment you say something like that, because you don't get vacation time as a farmer, right? You got to be there and you got to be on when the crop's ready or when the cows need milked or when it's time to feed the cattle, right? All of those things are just something you have to do. And so making sure that those practitioners and providers that work with farmers in the community understand kind of how to do that. And so I think those are some really important conversations that need to be had, because there's a lot of folks who didn't grow up on a farm or don't understand farming, agriculture, ranching, that may unintentionally do things that are more harmful and turn people away from getting care in the long term.
And very similar conversation that was with law enforcement. Exact
Absolutely.
same thing, because you're
Right.
saying, well, you don't have to always be on call, or you don't
Right.
have to be the first one to show up at the scene. And
Well, you do.
Yeah, they kind of do.
Yeah, you
So,
do.
you know, in an off-cuff conversation like that, or a statement might think, no, that therapist isn't for me. They don't even understand anything. The next breakout session, we were busy. We
had our own breakout session to deliver. Yeah. And we had a full room, just not to toot our own horn, but this was both a virtual conference. And so, you know, all in all, we had close to how many participants?
Like 80.
Over 80. The room was full, standing room only, and a very interactive discussion with folks. You know, and, you know, I always love coming and talking to a new audience in a different area, because we learn. Sometimes I feel like we learn more from the audience than they learn from us. I'll be honest with you. But, you know, I did learn a lot about disconnections here, you know, and as we go through, we'll kind of reflect back on some of the things we heard and kind of where we see opportunities in developing and growing their systems.
Yeah. And this was the first time we really started adding a justice involved message. And so having people that really see that. And for those listening, if you guys think about this, you understand this, but the folks that are chronic in your healthcare are often chronic in that mental health disability space, are often justice involved. And it becomes the same people or the same families that kind of loop through the systems. So if we work as their 3 independent silos or 3 different state departments, it's very unhelpful, because the person that's incarcerated's children end up with human services involvement or in Medicaid involvement or whatever. And so that's the same families that are struggling, and they struggle in all the sectors. And so one of our big messages, the same as usual, is talking about how do you make those connections and how do you bring the people to the table?
And it shouldn't surprise you, but we kind of pulled who's in the room. We had everyone from every sector. We had school staff, we had hospital administrators, we had mental health center folks, we had people from the state. It was everyone, which goes to your point of there's a recognition of every sector. I was surprised by how many people in the educational system and school districts came to our session, because they're like, we have a lot of parents that we need to engage with. We have a lot of families who are across all of these systems, and we don't know how to collaborate.
But at the same time, we noticed as vendors and as people attending, nobody in law enforcement.
Yeah,
The
nobody.
system, which is exactly our point. It's like, again, those are siloed out. There's probably corrections types of conferences that they go to, but there was nobody here. And that's different than what we've seen up north.
Yeah.
Because where we've been up north, we've at least had security present, and we've had some law enforcement sheriff's deputies sometimes having conversations in that. And it's not going to really work when we get to the conversation on mobile. Not going to work if you don't have your sheriffs and deputies. Now, I did do a lot of conversation in my breakout on CIT, which is critical
intervention training.
Thank you. Training. She says it's team. Critical intervention team.
Yeah, you can. It's interchangeable, I believe.
Okay. We try not to use acronyms. So I couldn't.
CIT. Yeah.
But she talked a lot about that, and they're saying that if they can get over 20 to 40%, between 20 and 40% of any department trained, then that really flips the ability to actually respond correctly and de-escalate situations. And so they were talking, and being in a new state that we're not really from, there was a lot of very specific Alabama conversations. They have 66 counties, and they would throw out all these counties as if I understood any of this.
67 counties. 67? You said 66.
Oh, darn it. I forgot one.
Alabama has 67 counties, everybody.
There you go. But they would say, well, this county has really good CIT training, and this county. It's very common to Iowa. It was in like the more populated areas.
Right.
So when they're Huntsville, they're Mobile, they're Tuscaloosa, they're Birmingham. And then, of course, when you get to the more rural communities, just like us, struggle bus. And so but they did have the conversation, but again, not really people there in that sector. So they're still missing that gap like we were talking about.
Yeah. And really, that's a good transition into kind of the next section of rural Georgia 988 and implementation, right? Because as we look at, what we're hearing is a lot of pressure on rural hospitals here. We have a lot of down in the South, and we know this just looking at the, generally reading about it, not hearing about it firsthand, but a lot of those rural hospitals, they don't have many critical access hospitals per se in Alabama specifically. I think there's more across the border in Mississippi, from the doctors I was speaking with, but really looking at a lot of those hospitals moving toward the rural emergency designation, getting rid of their beds because they can't make it, because it just isn't cost effective for those rural hospitals to stay open, which is really putting a lot of pressure on those rural communities, which is where 988 comes in, right? Of still looking at how do we manage crises? How do we support folks? And I think it's been a rough transition here,
Yeah. So 988, for those that don't remember, three-legged stool, they have to be somebody that answers the phone in a timely manner. Then they need to have a response of some sort, including mobile, and then a place to go. And as you can guess, they're working on that piece to answer the phone, but then the mobile responses challenge them and the places to go, which is very common across most states.
Mhm.
And so right now it's not really a stool and it's not really standing because there were questions in some of the breakouts I was in that says, who knows about mobile? Oh, that was in the plenary session.
Yeah.
Who here knows about Alabama's mobile crisis? And
Not many people raise their hands at all.
it's like maybe new, I guess, because it's not good. And so they're really struggling on the same bus as lots of others. We're not bashing anybody. Oh my goodness. Somebody tried to tell me that they were the worst in the country on blah, blah, blah. And I'm like, have you seen Iowa stats? Have you seen something?
Right.
I mean, we're not trying to compete for the worst, but I was like, don't feel bad. I mean, we're all struggling together. And so with the 988 conversation, it's really important to think about like, how are you going to grow from where you are? And again, we've talked about this before, but there's different ways to respond in mobile. Some of that's law enforcement based, some of that's layperson based, some of that's clinical based, some of that's attaching to more of a first responder model. And so they have to just, what we recommend is that you see what you have and build it from there. Because if you try to push, it's all going to be clinical, people that go out and you don't have enough of them, then you're already setting yourself up to fail.
Mhm.
Or if you're going to say it's all law enforcement and then people respond poorly and then you don't de-escalate correctly and a lot of people end up harmed, that's going to fail. So you've got to think about, okay, what does the system, could it look like based on what
Right.
we have? Like, what are
Right.
our resources? And so we're not experts in Alabama on what their resources are, but they need to think that through because they absolutely have to for the 9-day
Right.
rollout to
Right.
have all these legs to the stool.
Right. Absolutely. And I think that's part of the conversation we've had while we're down here as well is how do you make things culturally appropriate? So you're appropriately responding based on what that unique culture of each community is, because we see so much culture down here across the different communities, not just rural and urban culture, right? There's just so much his history as well. I mean, so there's been a lot of, historical things that have happened in this part of the country. And so you have to take all that into context today as the system develops, and how do we reflect the needs of everyone that the system is designed to serve. And I think that is a great challenge, especially in an area that we're in here in Alabama.
Yeah. And what I also appreciate the rest of the day is looking at lots of other topics that are common in other states. One being suicide prevention. There's a lot of conversation nationwide about what are we missing, right? You're trying to diagnose people with different diagnoses, but that doesn't necessarily equate to they're going to be suicidal. So there's pieces that we're missing to be able to predict that better, to be able to understand the why behind it or who's going to be next. And so just looking at any kind of model. So they've brought in Georgia to talk about what that could look like for Alabama. And I think that's really smart because you've got some pockets of places have some different ideas that they're trying. And it's nice to be able to learn. Like you said, we learn more at these conferences sometimes than we know. Been learning new things about what could we take home for us to try.
There's also some really great pushes and initiatives here about Narcan and getting Narcan out in communities. And so we saw a lot about that, which I thought was really great, that there's definitely a conversation happening here about that. Another huge part of this conference was really prenatal and maternal care.
Yes.
And so there was a big focus on prevention, right? Of really looking at postpartum depression, looking at kind of the whole health spectrum there, in women's health. And so I think that was also a really important takeaway from this conference, is tying all those healthcare and mental health pieces together, and how are those systems working together, and how are they really working on breaking down the stigma across the board.
Yeah, the other thing I really appreciated too is the conversation on diversity. The lady that we talked about earlier, Ashley, that's the PhD, was talking about the fact that a lot of people in their mind think rural means white farmers.
Right.
But the migrant workers and the other languages now that are in all of our states, especially with farming communities, is really great. And so they talk specifically about generational trauma and Black males as one of their pullouts and one of the breakouts. And so just thinking about how awesome that is, that people can think about it from a diversity perspective and to be able to come up with, other things that are needed, because it's definitely a challenge throughout all of our communities. And we may not have the right providers yet that are with the right cultural competency to do the work.
I think she quoted 22% of the rural population is non-white. right? So that image we have of an old white guy being the farmer, we get that a lot, in the Midwest. But that's actually not the face of rural America. And so
No.
I think, we need to think about, are we supporting what the true face of rural America really is?
Right. And so making sure that we think about that. So they've done a really great job with the maternal health, but also thinking about this. So what I found interesting, I forgot to mention this. We talked about our talk, but they were talking to us where we're sitting here talking about justice involved, and they're asking us questions about how it impacts people that are birth to 3,
Mhm.
which I thought was really interesting because birth to 3. So they're like, well, we have the incarcerated children. And
Right.
off the top of my head, I cannot say that I actually know of too many programs that we have, even with our prisons, to connect that dot on the outside. So that's an idea that I learned, and I'm going to take back to ask, how are we helping our folks
Mhm.
reenter with their children? 'Cause it's a very good question, because right now in my brain, I see that as very siloed in our state, and that could be something we could grow on and learn. So did you think of any other things you wanted to bring back with you from here? Have you
Well,
thought of-
I was going to step back and just say the way the conference was set up was, VitAL Alabama
What is
is actually a partnership, right? So VitAL Alabama is a partnership between Alabama and the state agencies and the University of Alabama.
Yeah.
And so it really feels like a true partnership. They really bring a lot of these projects under one umbrella, use the leadership from the university to leverage expertise, and then bring partners and organizations together in order to deliver this. And so I think it seems really more collaborative than what I've seen even in our own state of how universities can be utilized.
It feels a lot like when we went to the Rural Health Conference in Illinois,
Yeah.
being on the University of Illinois campus.
Right.
And so the campus has opened up to us and welcoming us here, and Illinois feels that way.
Right.
Maybe we just feel a little more disjointed
Well,
in Iowa.
Yeah, and even the students who were invited into the same venue to listen to Johnny Manziel at 6 o'clock for the evening after the conference, right? So like it's not just about the conference, and a lot of conferences you go to the networking thing afterwards. Well, this one was no, we're going to open this up and invite the students that we really want to impact, and invite the public, right? I was getting on my social media, I was getting advertisements of come hear Johnny Manziel, be part of this activity. And I think that was kind of cool, right? Because it wasn't just a conference. The university leveraged the money they had to do a conference, and they made sure it benefited the students, the public, and the local community, and all the participants in the conference. And I think the more conferences can do that, the more welcoming they are, and the better it is getting the message out. And so I think more conferences, I'd really challenge more conferences to really look at, are they making an impact in their local community at the same time of utilizing all of that education and all of that brain power that comes to these conferences. And I it's kind of refreshing when you see that. I wasn't expecting that to come down to Alabama and be like, wow, they've really got a successful way of bringing people together, of leverage, because sometimes it's hard when you've got state dollars and they funnel through a university. Sometimes it misses, right? It misses the mark of what they're trying to do. But this one felt like they were all cohesive.
With Johnny Manziel here, we didn't mention the media. And so the media was here in the morning for the plenary, and they had it open to media, and so they could see him, and then they use that to advertise to bring people back at night for their free. That's brilliant.
Right.
And so he had a really good message about hope and about recovery from substances and mental health. And then he was able to give that to the public for free. So they did a paid conference. We all paid in, but then they could do it free. It was really, really
It's a much bigger impact. And so someday at a conference, you really wonder what the impact is after a conference, right? How many people take back? Think about yourselves when you go to a conference, right? I know all of our listeners go to a conference, at least once a year somewhere. Most people go to a conference in the sector that they work. But, what do you take back with you? And how do you utilize what you took back, right? And so I think showing more impact is really refreshing.
Yeah. And to that point, the other thing that we like to do is really make contacts and network when we're at conferences. And we had, at the end of our session, several people that we hope really do follow up. We hope so. We gave them our information to do so, but really good questions about.
I'm already getting emails, Renee. I'm already getting emails. So
we have examples of things we talked about. Could we share with them a template in one case? Could we help? There's a lady that's working on a dissertation in rural. Who needs some other candidates, some leadership in rural. And she says, you look like you guys have a network. Could you help me and introduce me to people? Absolutely. We could.
That's what we do.
That's what we do. So it was really cool to be able to network and help. And so I'm excited to see what comes. Everybody's still in the conference right now, but when we're done the next day or so, who really does follow back up. Because that's one of the key things that I've done at conferences. It's not just what I learned myself, but what I can bring back to help our team,
Right.
to help our state, and to be thoughtful. So on the VitAL Alabama, did they have some topics and some kind of themes that they're working on that they're going to move forward this next year? Because they have a conference again next year, I understand.
They do, I think kind of the projects they're focused on is, they lead the zero suicide project in their state, which, a lot of states have zero suicide projects, but, they're really the right person to be leading that. They have a lot of other specific projects to children, some peer support type projects, which are really exciting. They do expert. So that's the brief screening and intervention type work,
Okay.
Workforce stabilization programs, and a bunch of acronyms I can't quickly read off the sheet in front of me because you know what we say about acronyms, Renee.
Let me just show you. This was one talk. It was like 17 acronyms. Thumbs down. Don't do that, people. Don't do that. So Johnny Manziel doesn't use acronyms.
Not at all.
He knows the acronyms. AA.
AA. That was the only acronym. Renee says he didn't.
Well known.
We know. We should all know.
Knows, but everybody else was like dumping all the acronyms, and I'm just like writing them down, going, I don't know.
Right.
So before we get going today, we want to talk about another recovering politician self-care policy, because we always have that. But on travel, both of us the first night were just exhausted, and I just went to bed. I hit like a wall, and I don't know what that was about. And so my husband traveled with me, and he went out scootering. You can ask him about scootering Tuscaloosa, because he found the imaginary wall, which you can.
I did love hearing the story of Brent finding. I did love that story. I like that.
He passed the imaginary wall of where it no longer would work, and then he had to drag it back in so that it would start again. That made me laugh. But I don't know. I was in dreamland, and my body really, really needed it. I felt really good yesterday. And again, just thinking about travel, sometimes you have to just take care of your body and listen to it. It was early, and I was like, I am so sorry, but I am just exhausted, and I just needed the extra sleep. So I know
I had a 5:30 a.m. flight.
Oh, boy.
And so I had to be at the airport at the crack of dawn to get here. And if you remember at supper, we were doing some planning for the workshop we were doing, and I knocked some water over because I was so tired. And it was like supper at like 5. It was 5 p.m. or 4:45. We're at supper.
We're at the senior supper.
It was senior supper. I was like, I'm tired. We just got to prep. I was in bed by 7. But you know what? I felt great. I still feel great, right? Because I had to stay on track, right? And we talk about sleep. And when I prioritize sleep, things are so much better. And I think about all those years I didn't prioritize sleep, and I suffered. I wasn't at my sharpest point. And so I think that, the more we think about it, the more we can start to change our habits and build in sleep. Mm-hmm. It makes all the difference in the world. I'm a believer.
Right. Yeah. And for me, for many years, travel was when I'd get more exhausted doing all the things while travel, and then I'd have to catch up at home. And this trip, I actually did it the other way around, just catch up on sleep while I'm traveling, and I'm going to feel good going home.
Well, we're smarter about traveling because we do stuff when we travel. There's a lot of other little things that happen on travel days. And speaking of travel, do you know where the next National Association of Rural Mental Health Conference is coming up May 1 to 3, Renee?
2025?
2025, this next May.
I believe that too.
It's not too far away.
Where's it going to be?
It's going to be in Anchorage, Alaska.
Oh my God.
I think we should go.
Rural, remote, and frontier. That sounds like.
I think we should go.
I think we should go.
It's going to take a travel day on the front and back of that one, though. I'm pretty sure there's a travel day involved. Yep.
Super exciting. So if you're a person that want to know more about the National Association of Rural Mental Health, you can look them up. It's NARM is how they pronounce it. NARMH.
We'll link to it. We'll link to it in the show notes today, so you can get there.
Because you could join them. They have a really reasonable membership, and you get opportunities throughout the year to be able to join some of their webinars, some of their conversations. They're currently working on legislation at the federal level and are asking for people's input here, and would love for you to, if you're interested in input from the federal level, check them out in our show notes, and then you could be part of that conversation. And maybe you join us in Alaska next year.
That'd be fantastic.
So today we talked all about the conference, and we're in Alabama. So the VitAL Alabama conference that's in partnership with NARMH. And we're excited to have been here. We spoke here, talked about all the great people that we've met, the networking that's been done, and many, many things that we've learned that we'll be bringing back toward our community to hopefully implement. We'll see you next time.